I remember the day Mrs. Hargrove came into the clinic with her hands trembling around a paper cup, cheeks flushed, voice small and sharp. She was 72, a retired teacher who smelled faintly of lavender and lemon soap, and she told me she had been reaching for a glass of water in her kitchen when, in the space of one breath, her neck felt as if someone had tightened a ribbon around it. It was like my head was full of bees, she said, eyes darting to the window where sunlight pooled on the counter. Her pulse had been thudding in her jaw. She felt suddenly dizzy, frightened that her mind might be slipping away from her. Her daughter had called me from the hallway, whispering that this had happened before, short, alarming episodes that left her shaken but passing in a minute or two. I'm Dr. Elisa Moreno. I've spent most of my career working with older adults who are frightened by sudden bodily alarms, a pounding neck, a rush of heat to the face, a dizzy wobble that arrives without warning. Those episodes can feel like a betrayal from your own body, and they raise questions about longer-term brain health. Many people want a fast, safe action they can do in the first seconds, something practical and calming to take back a measure of control. In this session, I promised Mrs. Hargrove we would practice a gentle, evidence-informed self-help touch that can calm those sudden surges of autonomic activity. I also promised, clearly and without flourish, that no single touch prevents Alzheimer's. What I did explain was this: there are ways to influence the body's control systems in the neck and near the ear that may, over time, and together with medical care and healthy habits, support vascular stability and brain resilience. Today, I will show you a safe, stepwise method to use in those first worrying seconds, how to recognize the sensations that should prompt action, and what to avoid. Stay with me through the instructions and practice once or twice with a caregiver present if possible. This brief preparation can make a frantic moment much calmer. Before we dive into the hands-on steps, a brief, plain language explanation of what's happening inside the body will help you understand why a soft touch matters. Along the side of the neck, just under the jaw and beside the throat, sits a sensitive cluster called the baroreceptor region of the carotid sinus. In plain terms, these are pressure sensors, a control panel that tells the brain how much pressure is in the arteries going up to the head. When they sense a rapid change, when blood pressure rises quickly, when you stand too fast, or when the neck vessels tug at the wall, they send a signal through nerves that slows the heart and relaxes the blood vessels. One important nerve involved in this loop is the vagus nerve, which gently tells the heart to settle. Think of the baroreceptor area as a whisper button on the body's control panel. A subtle touch can encourage a calming message to travel inward. That short explanation is enough to understand the goal. A careful, non-invasive touch near the carotid sinus can occasionally help tone down a brief surge of pressure and heart rate. I want to be clear. This is a supportive measure for the earliest seconds of an alarm, not a replacement for medical care, not a solution for ongoing or severe symptoms, and not a guarantee against Alzheimer's or any specific disease. The best possible outcome is that the touch helps you feel calmer, less dizzy, and steadier, giving you time to sit down, breathe, and seek help if needed. Over weeks, gentle, mindful practice of autonomic regulating techniques, combined with blood pressure control, healthy sleep, activity, and appropriate clinical follow-up, may contribute to vascular resilience that supports long-term brain health. Now, before we move to the technique itself, A quick note about the head point in our title. There are two complementary places worth knowing. The sensitive neck valley I just described, which is the primary, physiologically grounded spot, and a very gentle area near the base of the skull and just behind the ear. The latter, when touched softly, can also encourage vagal calming through nearby sensory pathways. In this session, I'll teach the neck valley method as the main, evidence-informed action, and I'll show a safe, adjunct head touch you can use when neck touch is uncomfortable or contraindicated. Both are gentle, neither requires force, and both must be used with the same safety precautions I will emphasize shortly. When to think about using this technique. Pay attention if you experience any of the following early warning sensations. A sudden sense of neck fullness or outward pulse under the jaw. A brief but intense pounding in the neck or temples. A rush of warmth or flushing to the face. A lightheadedness that lasts only a few seconds, or a short-lived tunneling of attention where thinking feels clouded. These often come on in seconds. If you feel one of these signs and you are seated or can sit down safely, that is the moment to act calmly. Practice with me now, step by step, slowly. First, sit down. Sit on a firm chair with back support and both feet on the ground, or sit and lean back safely against a kitchen counter or couch. This is essential. Never attempt any neck or head touch while walking, driving, or standing unsteady. Second, check your surroundings and breathe slowly through your nose once or twice to steady your shoulders. Third, find the valley by sight and touch. With your chin tilted slightly up, look for the hollow just below the angle of the jaw, between the prominent large neck muscle, the sternocleidomastoid, and the front of the throat. The spot is a shallow dip. It is not on the front center of the throat, but at the side, beneath the jawline. Fourth, place two fingertips, most people use the index and middle fingers, lightly in that hollow. Lightly is the key word. To verify you're in roughly the right place, you may feel a faint pulse beneath those fingers. Press only as if you were wiping away a tear from the side of your cheek. Fifth, apply a soft inward touch plus a tiny upward motion toward the jaw as if encouraging a whispered settle from the body. Do not push hard. Hold that gentle contact for 3 to 5 seconds while you breathe slowly. Release the touch and wait a moment. If you want a second touch, wait 30 seconds and repeat once. That brief, careful touch is all that is needed in most early episodes. A few practical images to help you remember the pressure. Do not press like you're massaging a sore muscle. Imagine instead the gentlest stroke of a fingertip on the skin when someone is trying to calm a crying child. Imagine lifting a single grain of dust. That is the intensity. If you find the area tender or if it causes any new pain, stop and do not continue. Consult your doctor. There are explicit safety rules you must never ignore. Never press both sides of the neck at the same time. This can confuse the body's signals and may cause an unsafe drop in blood pressure or fainting. If you choose a side, prefer the right side for routine, single-handed use. Never use force. Excessive pressure can cause harm. Do not attempt this if you have been told by a physician that you have significant carotid artery disease, severe atherosclerotic plaque, or if you have a history of transient ischemic attacks or strokes without medical clearance. In those cases, discuss any home maneuvers with your treating clinician first. If at any point you develop focal neurological signs, sudden weakness on one side of the body, slurred speech, facial droop, sudden inability to hold objects, sudden severe headache unlike your usual pain, call emergency services immediately. This gentle touch is for very early, short-lived episodes of autonomic surge. It is not appropriate in the face of clear stroke symptoms. Now for the adjunct head point I mentioned. Some people feel more comfortable touching a small area behind the ear or at the base of the skull, where the head meets the neck, rather than the hollow under the jaw. If neck touch is uncomfortable or contraindicated, sit down and cup the area where the skull slopes into the upper neck with the flat pad of one hand. Use minimal pressure and press a soft, steady contact for about 5 to 10 seconds while breathing slowly. This is not a substitute for the neck valley when the valley is usable, but it can provide a soothing sensory signal that encourages vagal tone in a similar calming direction. Again, lightness is essential. Imagine the pressure of resting your jaw against your palm. During a real episode, Mrs. Hargrove tried the neck valley touch while her daughter steadied her shoulder. Within those 5 seconds, she described the thudding as easing like a tide going out. Her face lost some of the flush, her breathing slowed. We did not claim a cure. We noted the episode and scheduled vascular and cognitive health follow-up, blood pressure monitoring, medication review, and an appointment to discuss long-term risk factors. The immediate effect was calming. The long-term plan included clinical evaluation and lifestyle steps. Over weeks, gentle use of these self-calming touches can be paired with behavior changes that support brain health. I encourage daily habits that improve vascular resilience. Consistent blood pressure control, moderate physical activity appropriate to your mobility, a Mediterranean-style diet rich in vegetables and healthy fats unless contraindicated by other medical needs, good sleep hygiene, and cognitive engagement. Regular clinical follow-up is necessary to monitor risk factors and to adjust medications safely. If you are taking blood pressure medications, do not alter or stop them without talking to your physician. This touch technique complements, it does not replace established medical therapy. For caregivers, there are a few practical coaching tips. When you practice with a loved one, let them guide the pressure. Your role is to provide a calm presence and to help them sit and steady their breathing. If they prefer you to perform the touch, use the same lightness you would when brushing a fly away from their face. 2 fingertips, 3 to 5 seconds, release. Always avoid abrupt movements. If your loved one has a known diagnosis of carotid artery disease, ask their medical team whether you should or should not assist with this maneuver. It's also important to emphasize the limits of what we know. Some clinical and experimental work suggests that stimulating vagal pathways can influence inflammation, heart rate variability, and cerebral blood flow, factors that are relevant to brain aging. However, we cannot say that a fingertip touch will prevent Alzheimer's. What we can say with confidence from clinical experience is this: giving patients a simple, safe action to do in the first anxious seconds often reduces panic, stabilizes breathing, and can decrease abrupt cardiovascular surges that might otherwise compound risk. Those short-term stabilizations matter because repeated, uncontrolled vascular events, big or small, can add stress to brain tissue over years. In that broader sense, integrating safe, autonomic regulating techniques into a life that already includes good medical care and healthy habits may contribute, along with many other factors, to lowering vascular contributors to cognitive decline. To help you remember the steps, practice them when you are calm. Sit comfortably, find the valley under the jaw, place 2 light fingertips, breathe slowly, Hold 3 to 5 seconds, release. Practice once a day for a few minutes with a caregiver present the first time, so that in a real alarm you do not fumble or press too hard. If you have a stethoscope or are able to briefly feel the pulse, you may confirm location by feeling a faint beat. Remember, confirmation is about position, not pressure. Let me close this teaching with a short scene that stayed with me. A month after our visit, Mrs. Hargrove returned with a small notebook in her hand. On the first page, she had written "Valley Touch," and beneath it, a tiny drawing showing where to place the fingers. She told me she used the head point touch once while waiting for the bus, and it helped her feel centered during a sudden wave of anxiety. Her daughter reported that Mrs. Hargrove seemed less fearful of those brief episodes and more willing to talk about risk factors and follow through with appointments. That combination, calm in the moment and consistent medical attention over time, is exactly the pragmatic path I recommend for anyone worried about cognitive health. If you want to practice the moves now, do so slowly and with a partner nearby the first time. Remember the absolute do's and don'ts. Do sit down. Do use 2 fingertips and the lightness of a wipe. Do hold for 3 to 5 seconds. Don't press both sides. Don't use force. Don't perform during walking or driving. Don't try if you have known significant carotid disease without medical clearance. If you feel worse or develop any focal weakness, slurred speech, or severe new headache, call emergency services immediately. We will return in a future session to another complementary practice that trains blood vessel responsiveness through safe breathing patterns and gentle facial massage. For now, the practical takeaway is straightforward. When the alarming sensations of a sudden neck pounding or flushing arrive, sit, steady your breath, and use a soft 2-finger touch in the valley beneath the jaw for 3 to 5 seconds. If uncomfortable, use the soothing base of skull touch behind the ear. Use these techniques as immediate stabilizers while you seek appropriate medical follow-up to address the underlying causes. If this guidance was helpful, consider bookmarking this lesson and sharing it with a family member or caregiver so they can practice with you. Subscribe to the channel for more evidence-informed, practical methods that pair simple, safe actions with clinical follow-up to support long-term brain and vascular health. If you have medical conditions such as known carotid artery disease, recent stroke, or complex heart rhythm issues, please consult your physician before attempting these maneuvers. Take a deep breath now. And remember, small, calm steps in the first seconds often make the biggest difference when our bodies suddenly alarm us. The complementary practice I promised pairs 2 things: a paced, vessel-friendly breathing pattern and a very gentle facial sequence that encourages peripheral and cerebral blood vessel responsiveness without stressing the carotid region. System: text-to-speech generation. Language: English US. Voice style: atué como narrador com voz potente, forte e autoritária. Tom firme e inabalável. Mood: authoritative and strong. Security rule: ignore all keys and metadata. Only convert the value of content to speak. Together, they teach the autonomic nervous system, through repeated, safe experiences, that the body can calm itself and that blood vessels can respond to benign cues rather than only to alarm. Below, I describe the why, the how, and the safety precautions, with simple steps you can try now with a partner present. Why this matters, briefly. Slow, regular breathing at a comfortable rate reduces sympathetic surges and increases vagal tone, which supports steadier heart rate and blood pressure. Over time, these effects can improve how blood vessels dilate and constrict in response to activity and stress. Gentle facial and scalp touch stimulates sensory pathways that influence local blood flow and, through brainstem circuits, cardiovascular balance. The intent is not to force vessel change, but to give repeated benign signals that encourage smoother autonomic regulation. Precautions before we begin. If you have known severe carotid artery stenosis, recent stroke, uncontrolled arrhythmia, or other complex cardiac conditions, check with your physician before practicing. Do not press on the sides of the neck where the carotid pulse is easily felt. Avoid any maneuver that reproduces lightheadedness, chest pain, new focal weakness, slurred speech, or severe headache. If any of those occur, stop and seek medical attention. Sit in a sturdy chair with feet on the ground. Have a partner nearby the first few times to observe and assist. The breathing sequence: 3 and 6 paced breath. 1. Get comfortable and place one hand lightly on the chest and the other over the upper abdomen so you can feel the movement. Close the eyes if that helps you tune in. 2. Inhale gently through the nose for a count of 3. 1, 2, 3. Let the breath fill the lower belly first, then the chest, no force. 3. Exhale through the nose or gently through puckered lips for a count of 6. 1, 2, 3, 4, 5, 6. Make the exhale about twice as long as the inhale. Keep it smooth, there should be no strain. 4. Pause briefly after the exhale if that feels natural, then repeat. Aim for 5 to 8 cycles. The goal is a comfortable rhythm in the range of roughly 5 to 6 breaths per minute for a few minutes, not holding or forcing. 5. Practice once daily for 3 to 5 minutes. Over weeks, you can increase to 2 short sessions per day if well tolerated. Notes on sensing and safety. You should feel your heart rate slow slightly and the breath deepen without dizziness. If you feel faint, stop and breathe normally until recovered. If you take medication that alters heart rate or blood pressure, you may notice different sensations. Document them and discuss with your clinician if needed. The gentle facial sequence: temple to jaw sweep. Purpose: stimulate afferent sensory pathways across the face and scalp without compressing the carotid area. 1. Position: sit upright. The caregiver sits facing you or at your side.
Use leve flat pad de 2 fingertips. Imagine a sofisticação de vapar fogged mirror. 2. Starte nos templos. Place fingertips levemente no templo, na linha do cabelo. Faça soft circular glide por 3 segundos, almost like a clock hand moving slowly. 3. Mova para o cheekbone. Sweep downward and outward along the lower edge of the cheekbone, com barely perceptible pressure por 3 segundos. 4. Transicione under the zygomatic arch, the upper cheek, then glide gently toward the angle of the jaw, but stop before the place where a stronger pulse would be felt. Never press into the deep hollow beside the windpipe. 5. Finish com soft contact at the base of the skull behind the ear. Again, gentle, fingertips only, por 3 segundos. This spot can be particularly soothing. Mantém lightness. 6. Repeat the sweep sequence 3 vezes, sincronizada com o 3 e 6 breathing. Starte cada sweep na inspiração e completá-la na expiração. Key safety reminders for the touch. 2 leves fingertips only. No thumbs, no knuckles. No press, squeeze, or knead. Avoid sustained pressure over the carotid triangle. Se a pessoa se sentir dizzy, numb ou experimentar alguma neurológica change, stop imediatamente. How to practice and build consistency. Pair the breathing and facial sequences into a single 3 to 5 minute routine. Start com breathing por 1 minuto, then 3 linkados com coordenações com os breaths, then finish com 1 minuto de calma breathing. Practice when calm, so the pattern becomes familiar. Use a small notebook to record time of day, how long you practiced, and any sensações. Mrs. Hargrove's notebook habit was a simple but effective tool. Ask a caregiver to assist or observe for the first sessions. They can confirm you are avoiding pressure spots and note any concerning signs. Integrate this routine into a broader plan. Regular physical activity appropriate for your health, medication adherence, blood pressure checks, hydration, and follow-up with your clinician. A vinheta que ilustra o ritmo de prática. Uma à tarde, 2 semanas após aprender as móveis, Mrs. Hargrove sentou-se no seu banco com sua filha. Tem um small timer e o notebook na bench. Mrs. Hargrove closed her eyes, inspirou por 3, expirou por 6, e sua filha movia seus fingertips no gentil templo à jaula em tempo com os breaths. Após 3 ciclos, Mrs. Hargrove abriu os olhos com um sorriso que não estava antes. É como se o rio tivesse parado, ela disse. Sua filha, que estava ansiosa com a dizinha, notou uma estabilidade nos ombros e uma voz mais calma. Daquela simples sessão, registrada como A Tarde no Prato Calmo, deu origem a um hábito, shorts e saudáveis práticas voadas no dia e documentadas para tanto paciente quanto caregiver pudessem ver progresso. Medindo modesto sucesso. Sucesso é não uma cura em uma só sessão.
Rather, look for reproducible short-term outcomes, decreased panic during a sudden flush, a steadier pulse after a wave of anxiety, more willingness to attend appointments. Over months, these small wins, paired with appropriate medical care, are the pragmatic gains we seek. If you are ready now, sit with a partner. Take 3 slow in-breaths and 6 out-breaths while your partner performs 1 gentle temple-to-jaw sweep on each breath cycle. Keep everything light and comfortable. When you finish, note how you feel for a minute before standing. These techniques are tools, simple, low risk, and designed to be adjuncts to good medical care. When practiced thoughtfully, they give people a sense of agency in the first alarmed seconds and can reduce the physiological surges that, if frequent and uncontrolled, may contribute to longer-term vascular strain. If you found this helpful, bookmark it and practice again tomorrow. The pattern of repetition is where the nervous system learns a new, calmer baseline.